Welcome to Canine Cognitive, saving dogs one brain at a time, where we explore the power of three. Three-question quiz that takes a few minutes of your time but will ensure that you have the tools that you need to protect your dog. Today's quiz, what I wish I had asked the vet. Hi, I'm Shamrock's mom, and this is Shamrock. And this quiz, which takes a few minutes, will give you questions that I didn't push to the vet just because I didn't know any better. And he was the vet, so I believed if there was any concern, he would have told me. He would have mentioned it. I was the first line of defense for my Shamrock, and I now know that I should have known the hard questions, and I should have asked them. And I should have been the one to be aware of making the decisions about what I thought she needed. So what I'm trying to do with this quiz is give you those tools, the hard questions, the things we don't think to ask about, or the things that we say, I'm not going to ask the vet about that, that's silly. But here, if you have these questions, they can enable you to not have the regrets and to not have to look back and say, why didn't I question the vet? Why didn't I ask that? So this will be worth everything for you. So let's get started. I wish I'd quizzed, pushed, prodded, asked the vet. My dog seems slower, less playful. So what should I ask the vet? About arthritis, age-related issues, or just don't ask? Because it sounds silly. My dog is slowed down, less playful. There must be hundreds of reasons for that to occur. So this question seems kind of easy. But because of that, many pet parents, and I was one of them, don't even think to ask. We kind of push it away. Oh, okay, it's normal. My dog is slowing down. They're less playful. Okay. No, not okay. And that's what I need you to be aware of. So the question here is, what would you ask? And I want you to think about the fact that this answer may have a twist. So let's see what happens. If you answered, number one, my dog is slowing down, so I think it's arthritis, so that's what I'm going to ask about, then you're only looking at the physical side, and you're really not considering all the possibilities. If you question age-related, you're assuming it's old age. Now, puppies can have slowing down and being less playful as they go into adult era. That doesn't mean there's an issue. But to get the best answer and the best advice from the vet, you need to ask a question that has kind of a non-answer. And here's what I think. You can ask both questions and even more. Like, could it be? There are lots of things it could be. Or maybe you don't know what to ask, could it be? So the blanket question to the vet is, what do you think? My dog's slowing down. Is there a concern? Do you think it could be a problem? And the best way to approach it with the vet, if the vet kind of says, no, I don't think it's anything really, whatever, is to ask them to rule out any causes that might produce the slowing down symptom. Then, if nothing is found, the next question is to find out what was ruled out. And then don't forget to ask, can this be dog dementia? Unless you've got a senior dog, most vets will probably say, no, I don't think it's dementia. But I am telling you, dementia many times starts with physical symptoms. My Shamrock did, and everybody missed it. These physical symptoms can start long before any cognitive ones. So that's why it's so important to know the background of what you're asking, and don't let anyone put you off until you have the answers you need to know. To be empowered, you need to keep probing, keep asking, keep questioning, researching, and finding out what you don't know. So don't limit your questions. Don't be afraid of asking the vet. That's what they're there for. If you think that the vet hasn't got the time or the patience, maybe you need to find a different vet, because this could be an extremely important question. It was for Shamrock, and I wish I had gone deeper. So don't accept old age as a diagnosis, because old age is not a disease. And unless there is proof of arthritis and any proof that that's what's causing the slowing down, then I still would ask, what else can it be? So let's continue now. Should I ask and bother the vet? This is always the first part that people think about. Do I really want to bother the vet? So this next question should really make you stop and think, I don't care if I'm bothering the vet. That's what I pay them for. So here's the question. My dog still eats and sleeps well, but has stopped wagging her tail, being happy to see me. She's probably fine, right? So most people say, why would I ask that? It sounds silly. Okay, so she decided she doesn't want to wag her tail anymore. Happy to see me, maybe, she's mad at me. So what would you think is the reason to ask? I'm going to suggest the following. Don't waste the vet's time. There's nothing wrong. Don't bother asking. Next, because these are changes and you don't know why, that's the best reason to ask. Or, well, I'm not sure. The dog seems okay. They're probably okay. These are probably normal changes. So why would I bother the vet until there are actually signs of cognitive issues? I am going to tell you that this question and answer is vital to a better understanding of how to help your dog and to knowing what is important to their health and their life, and what you really need to find the real answers to. So, this is a question that really needs to be asked. So let's see. If you answered number 1, don't bother, nothing's wrong, I have to disagree. I don't ever think that don't bother, nothing's wrong is a right answer in this case. And if you answered number 3, you're not sure, then I need to explain so you can be very sure that number 2 in this case is the correct answer. It is never a waste of time, because the most important thing here is changes. And when you see changes, you never know how important or unimportant they are. They can be early detection. They could be nothing. But if you don't tell the vet or discuss it, how will you know? You'll just watch it. If it keeps happening, maybe you'll finally say something if it's not too late, I hope. Or eventually you'll say, no, it was really nothing. I don't have to worry about it. But with Shamrock, again, the limping that she had and the not wagging her tail, not being happy to see people, after the limping, the physical, came the cognitive. And those were the first signs. She stopped wagging her tail. She stopped sitting in her favorite place. She stopped being happy to see us or see strangers. Eventually, she stopped barking at any strangers, and she seemed kind of uninvolved. And this is pretty much 3 years before she was actually diagnosed. So this is why I'm stressing these points. Let's continue. This is a hard one for me. because you can't go back. I can't woulda, coulda, shoulda. But what I can do is hopefully alert you to what you can do. So if I could do it over again, what would I ask the vet? What are the prevention methods important to take from my dog's dementia? Either that she started having it, hasn't had it, or to prevent it. Next, where can I get a list of early signs so that I can be aware of them? Number 3, where can I go to learn about dementia now before it might show up at my doggy door? I need to tell you that your dog's life is in your care, not the vet's, because you are the one seeing what's going on, and you're the only one who can be the conscience for the dog, because the dog can't speak up. You have to be the spokesperson. So consider what you would ask. And be sure the vet is running tests to rule out other issues. For one of the best ways to help diagnose dementia is to know that it's not something else. Because it's one of those when they are really stumped that it's really nothing else. And there are certain signs they can figure out exactly what it could be. And when it's dementia, there are ways to learn what it is. Okay, so let's see what we can do with this one. The correct answer for me would be to ask all of them. Yes, since dogs do get dementia, and we know that from what I told you, 50% of dogs will get dementia. It's not a might or a can, it is a will. And I'm sure as dogs are getting older, as vaccinations are becoming more prevalent, as chemicals in the home and in the air and in the soils and in the foods might be happening for your dog, dementia becomes something that is not as much of a might as a probable. Nobody wants to think about that happening. I certainly never even thought about the word dementia. Not until long after all the signs were there. But then there wasn't a lot that could be done. But there were some things, and that did help. But I don't want you to have to wait that long. And there are many things that can help prevent, delay, and treat this horrible disease. But you need to have the facts. So ask away. The more you know, the better the chance that you can defeat this disease, this demon, before it arrives at your doggy's door. So I want you to really consider that the vet works for you. And usually they're pretty good about answering questions. So don't be afraid to ask. Let's see what else we can tell you. So there's one more thing. Because my Shamrock went through the stages of dog dementia and I was totally clueless, I don't want that to happen to any other family, any other dog. Believe me, it is horrible to watch, horrible to go through. You feel so helpless, so powerless. And so many things are not true about what people think the dog is going through. That we'll discuss in another quiz. But I spent 2 years learning in order to help you and your dog and your family. I worked with over 50 experts in both veterinary sciences and in human sciences who dealt with dementia and Alzheimer's. And the reason I did all that is because after 11 dogs, I was powerless. After 11 dogs, I was helpless. And after 11 dogs, I watched my baby Shamrock go through this and couldn't do a lot at that point. So I'm hoping that everything I teach you will help you to be empowered where your dog is concerned. I wrote Doggy Dementia and Alzheimer's Shamrock Story to help you understand the dementia journey. It outlines what she went through with the comments of the veterinarians I worked with side by side to try to give you at what stage do they recommend what? How do they feel about all the different elements that can help, that can prevent? Treatments, if it is dementia. How you go about doing this and that, how you recognize signs, all of the in-depth to empower you to help your dog. So here's why. This is Shamrock's book. This is why I do it. Look at that baby. She was beautiful. She didn't deserve to have to go through a mindless time, to have to go through the confusion that I saw on her face. I want to help you to not have to look at your dog that way. Please visit https://goldencoolpress.com/dogdementia.html. There you will find a lot of information about dementia. You'll also find information about the book. But most of all, you might get some more insight. And I ask at this point, please help me on my quest to get this information to as many dogs, dog and dogs, to as many pet parents as I can. Please share this quiz, help other dogs, and you have my thanks. And that I know of Shamrock. And she would say, oof, okay. So I want to thank you for joining me and for listening to the Canine Cognitive Saving Dogs One Brain at a Time and exploring the power of three. 3 questions in our quiz that are prolonging your dog's life, we hope. Start now, learn, go to the website, check out the next quiz, Dementia, Facts I Learned the Hard Way. And I would appreciate any comments you have. If you have questions, please see the links below. Feel free to email me. I will be more than happy to send you back your response. Like the videos, subscribe, share. Thank you for quizzing. Have a great day. And here's to your dog's health. Bye-bye.